Hey, Dr. Steve Bjorn here with Core Rehab. I was going to show you a little demonstration of wrapping fingers for lymphedema. One of the most common questions I get and difficulties that patients have at home with lymphedema when they're in a situation where we have to bandage them is trying to bandage their fingers. It's very difficult to wrap your fingers, especially when you're doing it to yourself. You only have one hand to do it. So I was going to demonstrate how to wrap your fingers when you only have one hand to do it when you're dealing with lymphedema. So you have to get it anchored around your wrist first. So you might have to pin it against your body there for a second. Once you're anchored around your wrist, then you're going to come out to the end of your finger. You're going to get it around the end of the finger, and then you're going to work your way down to the base of the finger. Once you get down to the base of the finger, we're going to come back around the wrist again, and we're going to come out to the end of the next finger. So from the end of the finger, you're going to work your way back down to the base of the finger. And once you get to the base of the finger, then you're going to go back around the wrist again. It's important to go around the wrist each time. If you don't go around the wrist each time, it's going to slide off your fingers. If you just try to go straight from one finger to the next finger, it's going to slide off your fingers real easily. So get it around the wrist, come out to the end of the finger, all the way down to the base. And the vast majority of the time with these little gauze rolls, you won't be able to make it all your fingers with just one roll. So I'm gonna just take that little bit that I have left, anchor that around my wrist, and I'm gonna use another roll to finish up the last two fingers here. So we're gonna go anchor around the wrist again, and then we're gonna come out to the end of the finger, work our way back down to the base of the finger, go back around the wrist again, and then we're gonna come out to the last finger from the end back to the base. So we're pushing fluid back up towards the hand. You don't want to wrap from the base out to the end because you'll be pushing fluid in the wrong direction. If you have a little extra left, a lot of times you might see small little gaps in there. So you might come out to the little spot there where there's a small gap and then just hit that little bit right there to reinforce that right at the base of the finger. Sometimes you'll get little bits and pieces that wasn't covered quite as well, but you want it to be covered very well like that. I'm actually going to just end on the wrist on that one because you don't want to end. I was going to try to get this, but I didn't have enough, and I don't want to end on the finger. You want to end on the wrist. So instead of trying to get that back last little bit, we'll just tape that off. So you want to have it to where you have good coverage of all of your fingers. You can't see any skin through there. Then we're going to come and wrap the hand. So it doesn't matter if there's little bits and pieces of the hand showing. This wrap is just for coverage of the fingers. And it's supposed to feel fairly snug. It doesn't have to be super tight. I wasn't pulling as hard as I could, but just putting several layers on there. It's okay if your fingers get a little bit darker color, if they get a little bit cold, that's not a problem. If you actually have loss of sensation, if there's true numbness, if you have pins and needles, tingling, pain, throbbing pain, you feel that heartbeat in your hand pain, those are indications that it's too tight. If it's feeling that way, pump the hand, try to get it to loosen up just a little bit with that hand motion. A lot of times that'll be enough to take care of it, and it'll feel okay after you've gotten the hand moving because you push a little bit of fluid out of there. If it continues and you continue to have numbness, tingling, pain, throbbing, then you gotta take it off and start over again and just wrap it a tiny bit looser. So that's how you wrap your fingers for lymphedema, and we can continue with another one for up your arm and any other questions that you may have about lymphedema or about any other physical therapy related things. We can post some videos for you. Thanks.